Well, good afternoon, everyone. I'm Carmel Angelo, Mendocino County Chief Executive Officer, and I'm coming to you today with an update from our two health officers, Dr. Andy Coren, who is our health officer, and Dr. Mimi Doohan, who is our deputy health officer. And we'd like to talk with you today about the most current events that are occurring with our pandemic and with our pandemic response. I'd also like to say that it wasn't too long ago that I did a video for all county staff. And that video was released earlier this week. And the goal of that video was to really talk about what's happening within the county system, how we're moving forward, and also to remind people that we still need to have those non-pharmaceutical interventions. We still need to socially distance, we still need to mask, we need to wash our hands. The next day after that video was released, the governor released a statement saying no longer should we mask. Along with that, of course, the CDC released a statement on masking as well. So part of the goal of this video is to ask our resident experts, Dr. Coren and Dr. Doohan, what they think about masking and how to move forward. So before we get into the questions, I would like to introduce Dr. Andy Coren, our health officer. Dr. Coren.
Hello, everyone.
And Dr. Mimi Doohan, our deputy health officer. And Dr. Doohan, we know, was our health officer for the beginning of this pandemic and took us through some very critical times before she moved on and then just became our deputy. Dr. Doohan?
Yeah, greeting Mendocino County. It's my honor to continue to serve you.
Thank you. Okay, so Dr. Coren, let me go to you first. To coin a phrase, to mask or not to mask, I mean, what do we believe? Who do we believe? You know, we're hearing we're going to base everything on science this year. And so, you know, what is the science? Should we mask? Should we not mask? I'm telling people to mask based on what I think is the latest science. I'm not a physician. I'm not a health officer. What do you think, Dr. Coren?
Well, you know, many pundits and politicians have verbally tried to communicate before the guidelines have been published here in California. And really, I want to read the final documents before I make more confusion. But from my perspective, it's important to understand that the masks are the most effective, the least expensive, and the least invasive non-pharmacologic intervention to prevent the infection and transmission. And so, you know, as we look in the past year, we saw a lot of surging, and then we brought it under control with our non-pharmacologic interventions and with the vaccinations, which are currently the most effective way to control the epidemic. But not everybody is vaccinated, and it's really a mixed population there. So I think it's of concern that we move too quickly to say nobody has to mask anymore. In our county, we have done fairly well. But in the last few weeks, we've seen a significant increase in the number of cases and in our daily positive cases, and also in the percent of test positivity. So this makes me nervous that we are at the verge of a surge. And in fact, to put more emphasis on that, in the last few days, we've seen 5 admissions to the hospital. It's good that we have a strong hospital and that it's staying strong, and we're not getting to places where we don't have enough hospital or ICU beds. And it's good that we've gotten the vaccines out in record time in Mendocino County, but it hasn't protected us totally yet. So I think that certainly for people who are vaccinated and they're alone or outside, they can go without masks, with very minimal risk of transmission or contagion. But for the half of the population that is not vaccinated, I think they should really continue to be wearing masks indoors, unless they're alone or in their car alone. I think that they should be wearing masks outside when they can't be well distanced, certainly in any kind of crowded situation. I think they should continue to wear masks. We need to protect ourselves and our community. And those are the only ways that we're going to be able to do it. Now, what the governor and the president have said would be general masking orders. And actually, when it comes to healthcare workers and also workers in their jobs, the vaccination orders are not exactly the same. And so we would have to wait and see what the like Cal OSHA is saying about our employees and other people who are in high risk situations. And of course, anyone who is around people who are vulnerable, even if they've been vaccinated, it's safer to wear a mask. So I'll stop at that just to open up the conversation. And
Thank you, Dr. Coren. Dr. Doohan?
Yes, reflecting on our journey, Mendocino County, through this pandemic together, if you look back in the beginning, there was so much we didn't know. We didn't know if a mask would protect us. We didn't know if we could get COVID from surfaces. We didn't know if being outside was protective. We didn't know if kids would be willing or able to wear masks. And now there is so much information that we have. We know, for example, it's very unlikely that you're going to get COVID from a surface. We also know that it's very dangerous if you're not vaccinated and you have COVID to be sitting inside in closed quarters with someone else singing or eating. It's very infectious disease in enclosed environments. We know that kids are perfectly comfortable wearing masks under many circumstances. So what I recommend is to use what we've learned based on fact and science and to promote that among the population. What we're seeing shifting is in the beginning of this pandemic, we made orders to mandate mask wearing. That was done in Mendocino County by myself as the health officer before the governor made an order to make mask wearing, to mandate mask wearing. The government is not going to be mandating mask wearing moving forward. This is going to be something that we have to use our personal will and knowledge to do. So that's going to be what I predict, is that more and more it's going to come down to individuals to determine safe behavior. And in that regard, I'm vaccinated. I'm very grateful that I was able to be vaccinated. And I wear a mask at all times outside. Why? Because I'm setting an example. We don't know who's vaccinated and who's not vaccinated. So I'm going to wear a mask to make other people comfortable around me and to demonstrate how easy it is to wear a mask and to demonstrate that it's the right and good thing to do at this phase of the pandemic, which is not over. I also would recommend that to the extent possible, people should be outside where we know it's very productive, staying 6 feet apart. And if you're outside and you're 6 feet apart and you're not sick, it's a protective environment. So in that environment, if it's a controlled setting, that is a safer place to take off your mask. I also, for myself, when I'm indoors with other people that are vaccinated, for example, I'm fortunate that my entire family is vaccinated. We take off our masks because we're vaccinated and we're inside and we're in our personal private space. So I would recommend that all people wear masks when they're outside in public to demonstrate that it's easy, it's safe, and that it is a very protective thing to do for our population.
Well, thank you, Dr. Doohan and Dr. Coren. I appreciate that, because I think that if the confusion isn't there yet, it will be, because there are so many different messages coming from different arms of government. So what I'm hearing is take a cautious approach and mask. And that brings me to one of the other areas that we're looking at within our county, certainly, is around testing. And so, there is this belief that if you've been vaccinated, you don't need to test. And I hear that from more and more people in the public. So, Dr. Coren, if we can start with you, if you're vaccinated, do you need to test? I think it goes back to, if you're vaccinated, can you get COVID? I think there's still a belief that if you get vaccinated, you could never get COVID. And, you talked about numbers going up. So are our numbers going up? I mean, do you think that we're in a surge?
well, there's a couple of questions there. First of all, understand that people can get COVID and carry COVID even though they've been vaccinated. I mean, it's a great vaccination, but they can carry it and they can transmit it. So it's not 100% effective. Nothing is 100% effective. There's a very small number that actually get COVID. None of them wind up who have been vaccinated in the hospital in our experience here. None of them wind up in the ICU or passing away if they've been vaccinated. But they can carry it and they can transmit it. So testing is worthwhile. The other reason that it's worthwhile is we have variants, these mutations that are becoming more of a prominent contributor to infection all over, but it's also coming into California and into Mendocino County. So we have been told that there are some variants of the UK, the B117 variety. And recently, in the last month, we had one that was actually from Brazil. These variants spread more rapidly, and some may have some resistance to vaccines. And we could see that the wonderful vaccines that we have could lose their efficacy as time goes forward if we don't control the spread that's currently happening, even though it's small. The more that this vaccine, this infection spreads, the more possibility for a mutation, and more possibility, therefore, for the mutation to be resistant to vaccines, and then we're without the defenses that we've had. So people are testing much less in our county. In the early days, when testing was scarce, we got great testing in our county, and our testing numbers were in the range of 400 and more, and now they're down to 100, 150. The state's average came down to 325. We're half that, and so we don't have the information that we need to be checking. How are we doing as a county? People could have asymptomatic or pre-symptomatic COVID, and they just think it's allergies, and we're not really getting testing surveillance going on. And so, yeah, the numbers have been going up in the last couple of weeks, and I'm concerned because we were among the first counties to proceed to the yellow least restrictive tier. And I think people, just as they feel that when they've been vaccinated, they don't have to worry about it anymore, when our county is in the yellow tier, they don't have to worry about it anymore. And that's the farthest from the truth. This is a growing, changing pandemic, and we have to keep our guard up until we've really gotten it, stamped out, and we're not there yet. So I think, we're seeing a boost in numbers. I'm not sure whether to call it a surge or not yet, but it could very well be a surge, and we have to treat it like a surge. And I think that, again, masking and the vaccinating are the weapons that we have at this point to fight this. So I would recommend that with the most high recommendation.
Thanks, Dr. Coren. Dr. Doohan, would you like to add to this?
From the beginning of the pandemic, I would be asked to predict what's coming next.
Yeah.
And I actually, I think we found in Mendocino County that my predictions tended to be right. And it's not because I'm psychic, but it's because I am a scientist and I think that way. So my prediction is that we are surging now, and that it is predicted by other health officers that we are going to see a surge coming, particularly after June 15th. So we had Mother's Day, and I think that's driving some of it, of the surge. We also had the yellow tier and loosening of restrictions, and that drove some of the surge. We also know that in June, on June 15th, the state is going to be dropping the restrictions that we have coming from the state government. And that's going to then open us up, and there's going to be more movement. And I think that's going to drive more of the surge. We also know that this coronavirus is somewhat seasonal, and we're anticipating that in the fall, as we get into the fall season, there'll be a surge there. So I think all of the evidence is that we are going to see another surge. And what do we do, Mendocino County, when we're having a surge? First of all, we do those things that we've been doing all along. We do case investigation and contact tracing, so that when somebody's infected, we figure out where they might have got it and who they contacted. We do testing. The testing is to contain the outbreak. We tell people to wear masks, to stay home when they're sick, and the testing is absolutely critical. If you remember back in the beginning, we didn't have testing, how desperate we were to have testing. Now we have testing in Mendocino County, and we're underutilizing it. So as we are seeing a surge happening, we must do more testing. And that it's become so much easier to do now than it was before. We have testing that people can even do in their homes, but we still have free testing available in Mendocino County. So the role of testing must continue to be prominent if we're going to save Mendocino County lives. We've been able to keep the death rate under 50 in Mendocino County. That's remarkable. And we could hold the line there, but testing will be an absolutely essential part of that battle against COVID. And then again, we have a new weapon, which is vaccination. And Mendocino County, while we're doing good compared to the state, we're not doing good enough. If we had everybody who could be vaccinated in Mendocino County, we would not be in the situation that we are in now.
Thank you, Dr. Doohan. Dr. Coren, it's it's daunting, part of it that here we are and we're still in this, hasn't ended yet. So with that, my final comments before I go to our two experts are that we continue to stay on top of the information. We continue to test, and it is an easy test. I've gone through every iteration from way up the nose to just around the nose. And so we know it's a simple test and it's quick. It takes less than 60 seconds once you get in there. So continue to test, consider vaccination if you haven't gotten vaccinated, and consider wearing your mask as best you can. And so Dr. Coren, really, I know you've talked a lot, and so have you, Dr. Doohan, and I guess this is just to reiterate this message, but what can we do? What can we do individually to stay safe and keep people around us safe?
Let's not say this is over. There's too many unknowns to say this is over. We've seen the surge in the summer, then we saw a huge surge over the winter, and now we're seeing a little bump. And I think Dr. Doohan is right to call it a surge. It would certainly be better to call it a surge than to ignore it. It's here, and it's got me worried, and it should have the rest of the community worried. So this pandemic is definitely not behind us. We have to take precautions and use all of our weapons that we possibly can, because the epidemic is changing again. We have variants coming in, and we don't know whether the next variant will be resistant, significantly resistant to the vaccine. So if we can vaccinate and mask and hold down the transmission at this point, there will be less multiplication, less variants, and we can stand a chance of saving lives in our community. So yes, mask, social distance, stay outdoors. It's great. It's the summer now. Get vaccinated, and if you have been vaccinated, don't leave it at that. Tell other people you've been vaccinated, and that it's freedom. You can do the things that you want to do now that you're vaccinated, and do them with the people you want to do it with. So spread it around, let other people know, and let's move together and let's save each other.
Thank you, Dr. Coren. Dr. Doohan, would you like to finish us up?
Yes, I would. But first, I'd like to ask you, Carmel, if people have suggestions or questions, what number should they call?
The number for the call center for the public to call if they have a question around COVID is 707-472-2759.
Mendocino County, I'd like you to write down the number of the call center. And if you have questions about where you can get tested, where you can get vaccinated, or if you have suggestions for how we can do a better job as the health officers, please let us know. This is a deadly virus. I am, as you know, as Mendocino County knows, I'm your deputy health officer, but I'm also working in a clinical environment in San Diego County in the chronic COVID clinic. And so I'm seeing patients who have chronic COVID. This is an emerging infectious disease, and we're learning quite a lot about it, but we still don't know a lot about what chronic COVID is like. So all of us in Mendocino County that are so concerned about Lyme disease, for example. Lyme disease is a chronic disease, and COVID acts in a similar way to chronic Lyme disease, except that it's even more serious. So for those of you who are wondering, how bad is it going to be if I get COVID? Just keep in mind that some people who got very mild symptoms of COVID have had devastating chronic COVID conditions. It's a chronic fatigue syndrome type of disease. People have chronic heart conditions, chronic lung disease conditions that come out of this, chronic neurologic conditions. So even though you might only have mild symptoms with the acute COVID, you might have devastating effects from chronic COVID. You do not want to get this disease. Not only is it deadly, but it could be with you for a very long time. So in light of that, we have this amazing vaccination program in Mendocino County. We are doing great with our vaccination program, but not enough people are stepping up now to get vaccinated. This is a very, very effective vaccine. If you were thinking that you did not want to get vaccinated in the past, please reconsider. This is the time to get vaccinated. Call the call center, find out where to be vaccinated, and please do it. If you are somebody who has some ideas for us about how we can get the vaccination to more people, please let us know. We want to hear your suggestions. Is it an access problem? Do we need to have vaccination sites more around the county? Or is it that we need to have conversations with people to reassure them? I was vaccinated, my whole family was vaccinated. I know literally thousands of people through the work that I do have been vaccinated, and they had no problems with this vaccine. So please help us to vaccinate Mendocino County. Please use our testing resources. If you're sick, stay home. And if you're going to have a gathering, please do it outside. Please stay 6 feet apart. Wear masks if you're going to be inside. And let's keep Mendocino County safe.
Thank you, Dr. Doohan. Thank you, Dr. Coren. Thank you for joining us today, and you will hear more from us in the near future. Have a good day. Thank you.